everyone, welcome back to Have You Heard with Aspire Audiology and Hearing Center. I'm Dr. Akila Prasad and I'm the audiologist here.
And I'm Alli. I'm the patient care coordinator here at Aspire Audiology and Hearing Center.
And we're going to kind of continue our conversation that we started last week, talking about hearing loss. And we talked about the different types of hearing losses, the symptoms. And now we want to really go into, we've done the test, you know you have a hearing loss, what now?
Yeah, so they have hearing loss.
Mhm.
What are the next steps?
So once we do the test and we diagnose that you do in fact have a hearing loss and it is affecting your processing, we will walk through the different kinds of hearing aids. So there's so many different manufacturers out there. It's hard to know what is the best fit for your ears.
Right.
So such a big part of the consultation is going through what each of the manufacturers has to offer and what really is best for not only your hearing loss, but your lifestyle. You know, if you're still working, you're in active places, you're communicating with a lot of people each week, there might be a hearing aid that's better suited to you than another manufacturer. So we do go over all of those details and narrow down what the manufacturer that's best for your ears is. And then we start that process.
Okay, that sounds good. But what happens if the test shows a hearing loss, but the person doesn't notice any difficulties?
That's a good question because that does happen sometimes, depending on the configuration of your loss. You know, if you have a very high frequency loss and it's really isolated to those high frequencies, sometimes it's harder for you to notice that you have a problem. A lot of those patients are the ones who say, you know, my spouse is noticing that I'm missing them, but I don't really feel like I'm having trouble.
Right.
And a lot of that, what I tell those patients typically is they may be in environments where they're not really noticing that loss because it's pretty quiet. They're only talking to one or two people. However, when we do the test and we look at how are they processing speech, their processing score is still pretty low. So when we look at a loss like that, what we have to really understand is your perception of how you're doing can be very different than what the test is showing. But if we do the test and we see your processing is still coming down below what we would like it to be, a hearing aid is still the solution. You know, you really want to get ahead of it if we see that processing score trickling down.
Okay, why is it so important to get ahead of a hearing loss?
So the biggest thing, kind of the misconception with hearing, is that we hear with our ears. We do not hear with our ears. Your ears are the mechanism that carries sound up to your brain. Your brain makes sense of everything. So when you have a hearing loss and we test you and we find that it is affecting your processing, the reason we always encourage you to get ahead of it and treat that loss is because untreated hearing loss, there's a direct correlation between untreated hearing loss and dementia. Untreated hearing loss, memory loss, and cognitive decline, they go hand in hand. Okay. So when we're looking at hearing loss, we're less concerned about, you know, what your ears are doing and what you're not hearing. And we're really more concerned about how is that affecting your brain.
Okay. So there is quite the connection there.
Yes, definitely. I think the biggest thing with getting a screening, getting a test is really looking at, okay, is there something going on with your ears? What is the degree of the loss, the severity of the loss? If it's something that we can monitor year to year, it's not really affecting your processing, we check your ability to understand speech and you're doing fine, then fantastic. We'll keep an eye on it. We'll make sure it's not changing over time. If you have a hearing loss, whether or not you perceive that loss, and we can see with the testing that the way that you are processing speech is much lower than the norm, then we always encourage you to get ahead of it. You know, talk to your provider about all the different options. Trust your audiologist or your hearing care provider's recommendation on what's best for your ears. Once you start that process, it never hurts to figure out, okay, how am I doing with hearing aids? Because the one thing I tell patients too is you only really know how you're hearing in this moment. You have no idea what it sounds like to give all of the sound that you're missing back to your brain. Right. And that's why trial periods with hearing aids exist. You know, with people who maybe have a trouble with perception versus what's actually going on, demoing devices in the office is a great idea, just so you have an idea of how am I hearing with these hearing aids compared to how I normally hear. And most of the time you find, wow, I'm realizing that I'm not hearing things, and I wasn't realizing how much I was missing in my environment.
Wow. Okay. Well, that answers all of my questions today. Thank you, Dr.
You're
Prasad.
welcome. So I guess if anyone has any questions about you have a loss, where do we go from here? Hopefully this video helps and you can talk to your audiologist about specifics.
Thanks for watching, and we'll catch you next time on Have You Heard with Aspire Audiology.